Welcome to Going Gluten-Free, off to a fresh start. My name is Katarina Mollo. I'm a registered dietitian and director of education at National Celiac Association. And whether you are newly diagnosed or have had celiac disease or another gluten-related condition for a while, we hope this course will give you a good overview of celiac disease, gluten-related conditions, and the gluten-free diet. Just some important notes. National Celiac Association and Katarina Mollo do not endorse any of the products mentioned in this presentation. And this information is meant for educational purposes only and is not intended to substitute for personalized medical advice or to replace any medical advice provided directly to you by your healthcare provider. No liability is assumed by NCA or Katarina Mollo by providing this information. So let's go over what will be covered in this presentation. So we will start off with celiac disease and other gluten-related conditions. There's symptoms, complications, diagnosis, and treatment. Then we will talk about the gluten-free diet, foods that are allowed, not allowed, oats, hidden sources of gluten, reading labels, and product research. And next, we will cover lifestyle changes such as emotional challenges, sharing a kitchen, eating out, and traveling. And finally, I will go over support and resources, what we do at NCA, and helpful web links. So let's get started. You are not alone. So, celiac disease actually affects nearly 3 million people in the United States. However, over 80% are still undiagnosed or misdiagnosed with other conditions. So, in the general population, about 1 in 100 has celiac disease, so about 1%. And of those with related symptoms, such as GI symptoms, 1 in 56 has celiac disease. Of those with first degree relatives with celiac disease, it is 1 in 22, and that includes parents, children, and siblings. And of those with second degree relatives with celiac disease, it is 1 in 39, and that includes grandparents, aunts, uncles, nieces, and nephews. Now, what is celiac disease? Celiac disease is a genetic autoimmune condition that mainly affects the gastrointestinal tract when gluten is ingested. But celiac disease definitely can affect the entire body. So what does this mean? So an autoimmune condition is when the immune system attacks its own tissues. The immune system is supposed to protect us from invaders, but in celiac disease, the immune system gets confused and starts attacking itself. In this case, the villi. So villi are very small finger-like projections that significantly increase the surface area of the small intestine. And the function of the villi is to absorb nutrients from food. And when someone with celiac disease eats gluten, the lining of the small intestine becomes damaged and is unable to absorb nutrients properly. And this can lead to deficiencies and other health complications. And celiac disease is also known as celiac sprue, gluten sensitive enteropathy, and is spelled differently with an O, but still pronounced celiac in the UK. So let's take a look at what celiac disease looks like in the small intestine. So on the left, you can see where the small intestine is in the body. And in the diagram on the right, we see a comparison of the surface of the intestine, one with healthy villi and one with blunted villi. So the blunted villi reduces the surface area of the intestine and leads to complications such as malnutrition and other health consequences. So although celiac disease mainly occurs in the small intestine, it can affect the entire body. Now, what is gluten? Gluten is one of the most common proteins in the human diet, and gluten can be found in wheat, barley, and rye. And gluten lends structure and elasticity to baked goods. It's what makes them fluffy and chewy all at the same time, and this is why gluten-free products often are crumbly. And because these grains are so common in our diet, it is hard to avoid them and it requires a lot of attention and skill to stay strictly gluten free. So, there are other conditions related to gluten apart from celiac disease. So first, let's take a look at dermatitis herpetiformis, or DH. DH is an itchy, blistering skin rash that's associated with celiac disease. In almost all cases of DH, the small intestine of a person is also damaged by ingesting gluten. And DH is diagnosed via skin biopsy by a dermatologist. And the treatment for DH is a strict gluten free diet and may also include medications to manage symptoms. So let's take a look at non-celiac gluten sensitivity, or NCGS. And this is an intolerance to gluten ingestion. And symptoms of NCGS are similar to those with celiac disease. But unlike celiac disease, there is minimal to no damage to the intestinal villi. And NCGS affects about 6% of the population. So it is estimated to be quite common. And currently, there's no test to diagnose NCGS. A diagnosis of NCGS can be made after celiac disease and wheat allergy. Both have been ruled out. And eliminating gluten from the diet is the only treatment for NCGS. And NCGS is also known as gluten intolerance or gluten sensitivity. So finally, we have wheat allergy, and wheat allergy is an allergic immune reaction, and that involves a different branch of the immune system than celiac disease. So it's an allergic reaction to wheat ingestion, and it may include a reaction in skin, mouth, lungs, and or in the GI system. And wheat allergy should be diagnosed by an allergist. And the treatment is a wheat free diet and may include medications to manage symptoms. So let's look at some of the symptoms of celiac disease. There are actually over 200 symptoms associated with celiac disease, and some people have no symptoms at all. And here are just a few of them. So, the classic symptoms most people associated with celiac disease are the gastrointestinal or those related to malabsorption. But as you can see, there are many other symptoms as well that you may not associate with celiac disease, such as the non GS symptoms, um, like fatigue, depression, joint pain, muscle aches, cramps, peripheral neuropathies, infertility, menstrual irregularities, and dental abnormalities. And that is why celiac disease is so difficult to diagnose, because there really isn't one typical case. And what are some of the associated conditions? So, other autoimmune diseases are common among people with celiac disease, such as type 1 diabetes. And among those with type 1 diabetes, about 3 to 8% will also have celiac disease. So, there's quite an overlap there. Um, Hashimoto's thyroiditis, which affects the thyroid, is also common. Sjogren's syndrome, which causes dry membranes. Rheumatoid arthritis, Addison's disease, which affects the adrenal glands, and autoimmune liver disease, lupus, vitiligo, which is loss of skin pigment. There's also an increased risk of cancer with celiac disease, and many people worry about this. But the good news is that the risk actually normalizes to that of the general population's risk within 5 years on a gluten free diet. So, this is one of the reasons why it's so important to stick to the gluten free diet to minimize risks. So, how is celiac disease diagnosed? So, the first step is to see your doctor, and they will do a thorough physical exam and take complete medical history. The next step is blood work, which tests for celiac related antibodies, also referred to as a celiac panel. And the most common antibody tests are TTG IgA, or anti-tissue transglutaminase antibody. And this is often done in conjunction with total IgA. And because if IgA is deficient, you may need alternate testing. Because these tests rely on IgA antibodies, they're not going to be accurate for somebody with an IgA deficiency. Another common test is the EMA, or the anti-endomysial antibody. And both the TTG and the EMA, they have very high specificity and sensitivity, over 95%. And then we have the anti-DGP or deamidated gliadin peptide, and that can be used for people who have IgA deficiency. So, next step is an endoscopy of the small intestine, also referred to as a biopsy. An endoscopy is considered the gold standard for diagnosing celiac disease. And during an endoscopy, an endoscope, which is a small tube with a camera at the end, is passed down the throat, stomach, and into the intestine. And it allows the doctor to check the digestive tract for inflammation and damaged villi. And tiny pieces of the surface of the small intestines uh, are taken out for examination, also referred to as a biopsy. And note that the endoscopy is still considered the gold standard for diagnosing celiac disease. There are some changes being considered to base diagnosis on blood work alone in certain cases. However, this is not yet common practice in the United States. And most importantly, to note here is do not begin a gluten free diet before diagnosis. Starting a gluten free diet before diagnosis can result in a false negative test. The reason for this is that as soon as gluten is removed from the diet, blood antibody levels will start to drop and the villi will begin to heal. So you should definitely keep eating gluten until your doctor tells you it's okay to start a gluten free diet. What about family members? Should members get screened for celiac disease? Yes, we recommend that specifically, first degree relatives of someone with celiac disease, so that's a parent, child, or sibling, should get tested. And those are high risk among first degree relatives, such as children or adults that have symptoms, should be screened regularly. And the recommendations on frequency vary, um, but it's usually in the range of 2 to 4 years. And serological or blood testing for presence of celiac specific antibodies is the best way of screening for celiac disease. You can also do genetic testing for celiac associated genes, which are HLA-DQ2 and HLA-DQ8, but genetic testing can only rule out celiac disease and it cannot be used as a diagnostic test. So the genetic test basically can just tell you if you don't have the genes. And up to 40% of the population, have the celiac associated genes, but less than 5% of those with celiac related genes will actually develop celiac disease. So how about treatment? So the only approved treatment for celiac disease is a gluten-free diet, free of cross contact with gluten, and beware of supplements claiming to aid in digestion of gluten. They are not tested on or approved for people with celiac disease. There are currently no medications available that will treat celiac disease. And also, it's really important to consult with a registered dietitian skilled in celiac disease to get you started correctly on the gluten free diet. A dietitian specializing in celiac disease can help you navigate the gluten free diet and also help you with any problems and adherence to the diet, as well as address any existing nutrient deficiencies. Some people may need treatment for vitamin or mineral deficiencies, and those with anemia may need iron, B12, and or folic acid supplementation under supervision. So it's really important to have regular follow-ups with your doctor to monitor your celiac disease. And your doctor will decide how often you need to see them, usually at least annually. And they will check your antibody levels and check for nutrient deficiencies. And they usually test your TTG and or DGP, and that will help indicate how well the diet is working. And they might check for certain vitamin and mineral deficiencies such as iron, zinc, B6, B12, folate, vitamin D. It's also recommended to have a bone density scan DEXA after diagnosis. And women in particular should have their thyroid levels checked at least yearly. And your doctor should also monitor for other complications or autoimmune diseases. So I still don't feel well. Well, it takes time for the small intestine to heal, and healing time varies for each individual. So it takes longer for some people than others. And healing actually begins within days, but it can take weeks to months to years to fully heal. So there may be a secondary condition causing delay in healing, so follow up with your physician if you're concerned. And those who do not get better within a year may have non responsive celiac disease. So it's estimated that about 7 to 30% of people with celiac disease still have GI symptoms, even though they have followed a gluten free diet for at least 12 months. And this is referred to as non responsive celiac disease. And here are the most common causes of not getting better after diagnosis: dietary indiscretion and an inadvertent exposure to gluten. This is probably the most common one of not getting better. Lactose intolerance, fructose malabsorption, or other carbohydrate intolerance, such as high FODMAP sensitivity, small intestinal bacterial overgrowth, or SIBO, other food allergies and intolerance, commonly dairy, soy, or corn, pancreatic enzyme deficiencies, microscopic colitis, and refractory celiac disease. Although refractory celiac disease is very rare, and that condition may also require steroids. If you are experiencing any of the symptoms, you should be discussed with your celiac specialist or healthcare provider. I highly recommend seeing someone who specializes in celiac disease, as they are very familiar, with the complications and disorders related to celiac disease, and they kind of know what to look for. And if you want to find out more about non-responsive celiac disease, you can go to our links section on the presentation landing page. So, as already mentioned, the only treatment for celiac disease is a gluten-free diet. It can seem overwhelming at first, but you will soon learn how to navigate this new diet, discover new exciting foods, and the gluten-free diet will become a way of life. So in the following slides, I will cover what foods are allowed, not allowed, oats, hidden sources of gluten, reading labels, and product research. The good news is that many foods are naturally gluten-free, and a gluten-free diet can be both varied and nutritious. All fresh and plain fruits and vegetables, meat, fish, eggs, poultry, milk, cheese, rice, potatoes, beans, legumes, nuts, and seeds are all gluten-free in their natural state. Note, if these products are not in their natural state or are processed, you must check the ingredient label. Beans, legumes, and nuts and seeds should be picked through and rinsed regardless of gluten-free statement. And here are some of the most popular gluten-free grains and flours and starches. So rice, corn, potato flour, quinoa, millet, amaranth, arrowroot, buckwheat, chestnut flour, lentil flour, chickpea flour, sorghum, soy, tapioca, and teff. So the bolded ones are more nutritious and higher in fiber. And an important note, only buy grains, flours, and starches that are labeled gluten-free due to the risk of cross-contact with other grains. And here are the gluten-containing grains and their different types and names that you need to be familiar with. So wheat, we have bulgur, couscous, semolina, farina, triticale, barley, malt, rye, sekale, and common types of wheat are durum, einkorn, emmer, spelt, farro, and kamut. And note that this is not a complete list, but the most common ones. So what about malt? Malt is almost always from barley and should be avoided, such as malt, malt extracts, malt vinegar, malt syrup, malt flavoring, and brewer's yeast. Autolyzed yeast extract, and brown rice syrup may contain gluten from barley. You should always check with the manufacturer about the gluten-free status of the product if any of these ingredients are in the listing, and if the product is not already labeled gluten-free, as manufacturers are not required to declare barley on the label. So what about oats? Although oats are naturally gluten-free, most commercially available oats in the United States have had cross-contact with gluten-containing grains through crop rotation, harvesting, processing, and transportation. And gluten-free oats are considered safe for most people with celiac disease, A very small subset of those with celiac disease also react to adenine, which is the protein in oats. So, what are some of the issues with oats? There are different protocols to ensure oats are gluten free. The purity protocol includes oats that have been grown in dedicated gluten free fields, as well as harvested, stored, transported, and processed separately from gluten containing grains. And some companies use mechanical or optical sorting to remove wheat, barley, and rye from commercial oats based on color and shape of the grain. However, this method is sometimes not adequate to remove all gluten and requires rigorous testing protocols. Neither method is standardized and can vary, so it's very important that either method includes testing protocols. And I really want to emphasize that it is the testing that determines possible cross contact with gluten, and that is key when you're choosing gluten free oats, regardless of the type of protocol used. So, we recommend that you should be symptom free and discuss introduction and serving size of gluten free oats with your celiac healthcare provider. And the oat or oat product must be labeled gluten free. NCA's recommendation at this time is purity protocol oats that are tested to contain below 20 parts per million of gluten, and those companies using mechanical optical sorting with rigorous transparent testing consistently below 20 parts per million of gluten. So, to read more about oats, check out our information on oats. A link is provided at the landing page for this presentation. There are many other potential sources of gluten to watch out for, and these are just a few, such as processed foods, medications, vitamins and mineral supplements, seasonings, spice mixes, soy sauce and other sauces, smoke flavoring, soup and soup bases, imitation seafood, imitation bacon, yeast extract or autolyzed yeast extract, and brown rice syrup, like I mentioned with the malt, French fries, and fried foods due to shared fry-o-later oil. So, what about alcohol? So, these are considered okay. Wines and gluten free ciders and distilled spirits, regardless of the grain source, as the distilling process will remove the gluten protein. So, brandy, cognac, gin, grappa, rum, sake, scotch, sherry, tequila, vodka, and whiskey are all okay, unless they've had something added to them afterwards. Gluten free beers are okay, but avoid gluten reduced or gluten removed beers. So the difference is, so gluten-free beer is a beer where the starting material is gluten-free, such as sorghum, and then it's fermented. But with a gluten-removed beer, gluten-reduced beer, the starting material is wheat, barley, or rye, and it's then fermented and treated with an enzyme to break down the gluten. And there's no test to accurately detect gluten in hydrolyzed or fermented foods. So there's no way of knowing how much gluten is actually present in gluten-removed beer. So it's not recommended for people with celiac disease. And here are the alcohols to watch out for. Um, so you cannot have malt beverages, beer, ales, and lagers. And the following may contain gluten, such as mixers, spiked seltzers, and wine coolers. Hard lemonade, they all may contain barley or other added ingredients that you need to watch out for. So always check the label on those. I also want to touch upon that there are some, nutrition challenges with the gluten-free diet. And some of the most common ones are that the gluten-free diet can be low in fiber, which may cause constipation. It's generally higher in fat, sugar, and high fructose corn syrup. And this is often added to increase the palatability of gluten-free products. And people with celiac disease are also exposed to higher levels of arsenic due to the fact that many products are rice-based. And the gluten free diet is often low in certain vitamins and minerals, such as B vitamins, iron, calcium, magnesium, and zinc. And finally, gluten free products are rarely fortified with iron, folic acid, or other B vitamins, like some standard products are. So, what can you do about that? Well, focus on nutrition. Eat a variety of foods, eat lots of naturally gluten free whole foods, such as fruits, vegetables, beans, and seeds, lean meats, and dairy. They are rich in iron, B vitamins, calcium, vitamin D, and fiber. Choose the more nutritious gluten-free whole grains first, such as amaranth, buckwheat, quinoa, sorghum, teff, and millet. And make sure to drink plenty of water and other fluids throughout the day to prevent constipation. And when choosing processed foods, choose enriched or fortified labeled gluten-free grain foods such as bread, cereals, rice, and pasta. So try and include these nutritious grains and seeds in your diet, such as amaranth, buckwheat, chia seed, flaxseed, quinoa, sorghum, and teff. And due to cross contact with other grains, always choose those that are labeled gluten free. Now let's delve into food labeling. So, reading the food label is one of the most important skills of staying healthy and gluten free. And reading the label is the quickest way to find out if a product contains gluten or needs further investigation. And read the ingredient listing carefully not to miss any ingredients. And always read the label even if you've had the food before, because ingredients are constantly subject to change. And check anything that you ingest, including foods, beverages, gum, mints, and candies, supplements, medications. And skincare is optional. So, a note about skincare. So, it is optional but not required to use gluten free skincare for those with celiac disease, as gluten cannot penetrate the skin. And we recommend skincare products to be gluten free if there's a potential that they might be ingested or if you have allergic skin reactions to gluten. So, a potential issue would be accidentally ingesting skincare or cosmetics through cross contact, such as you touching foods or putting your fingers in your mouth after using a product or ingesting products that go near your mouth. However, it is probably a far stretch that you would ingest enough gluten this way, but this could be an issue with children that suck on their hands or with shampoos and soaps if children drink the bath water. And there are often questions and concerns regarding lipsticks and lip balms. So, in a study by dietitian Trisha Thompson, a number of lipsticks and lip balms with gluten ingredients were tested and found to contain below quantifiable levels of gluten. And it was determined that it would be unlikely that lipsticks would contribute significant amounts of gluten to the diet, even if they contained higher levels. However, more research needs to be done on this topic. So, how do we read the label? So, follow these steps to determine if a product is gluten free. First, see if the product states that it's gluten free. This may or may not be listed. And look for an allergen statement because wheat must be declared on the label if present in all foods falling under FDA. Look at each ingredient carefully, particularly whether barley, malt, rye, and oat ingredients are listed. And always contact the manufacturer to verify gluten free status if unsure. So, what is considered gluten free? The Food and Drug Administration, FDA, considers food to be gluten free when it contains less than 20 parts per million, or ppm, of gluten. And this is considered a safe concentration of gluten based on daily intake for people with celiac disease. So, 20 parts per million is equal to 0.002% or 20 milligrams per kilogram. And this means that a 1 ounce slice of gluten free bread at 20 parts per million would contain about 0.57 milligrams of gluten. So, just to give you a little bit of a visual, how small 20 parts per million is, it is the same as 20 cents in $10,000, or 20 minutes in 2 years, or 162nd teaspoon in a gallon of milk. So it is a very, very tiny amount. What about gluten free labeling? So, some important things to point out here. So, gluten free labeling is voluntary. And food manufacturers, they're not required to indicate all sorts of sources of gluten on the label or indicate a gluten free status. And the FDA requires foods that are labeled gluten free to contain less than 20 parts per million of gluten, including cross contact. And the FDA does not mandate the use of a specific gluten free label. So, the gluten free statement or gluten free label may look different from product to product. So, which foods can be labeled gluten free? So, foods that are naturally gluten free and foods that contain gluten grains, such as wheat starch, but have had the gluten removed to below 20 parts per million, and foods that do not contain more than 20 parts per million of gluten and any unavoidable gluten in the food due to cross contact or migration of gluten from packaging material must be less than 20 parts per million. Just a note about wheat starch. So, wheat starch that has been processed and tested to contain less than 20 parts per million is allowed to be used as an ingredient in gluten free products that fall under FDA. So, note that not all wheat starch is the same. So, wheat starch that is used in gluten free products have been separated from the gluten protein and artificially rendered gluten free. And products that are labeled gluten free and contain wheat starch are required to disclose this on the label per FDA and include the following statement: the wheat has been processed to allow this food to meet the Food and Drug Administration's requirement for gluten free foods. So, what about gluten free certification? So, gluten free certification is different from gluten-free labeling. Gluten-free certification is done by a third-party organization, and there are several different certifications available, and they vary in the requirements, but all must adhere to at least the FDA standard of containing less than 20 parts per million. But a lot of them require less. What about allergens on the label? So, Food Allergen Labeling Consumer Protection Act, or FALCPA, labeling law requires to list major allergens in foods. So that's wheat, milk, eggs, soy, fish and shellfish, peanuts, tree nuts, and sesame. An important note here: barley and rye are not listed as major allergens, and wheat free does not necessarily mean gluten free. So, and under FALCPA, wheat will be declared in one of two ways: in a contains statement following the ingredient listing, for example, contains wheat, or in parentheses following the ingredient containing the allergen within the ingredient listing. So, for example, modified food starch and then wheat in parentheses. So, FALCPA applies to foods, beverages, and dietary supplements. FALCPA does not require any information regarding cross contact of foods. It doesn't apply to foods regulated by the US Department of Agriculture, USDA, or the alcohol beverages regulated by the Alcohol, Tobacco Tax and Trade Bureau, TTB, and prescription and non-prescription drugs, pet food, and cosmetics. So, what about USDA labeling? So, products under USDA labeling are meats, so beef, lamb, pork, poultry, eggs and egg products, and processed foods containing more than 3% raw meat or 2% cooked meat or poultry. And the USDA requirements are that all ingredients are required to be listed on the label, and USDA products are not subject to FALCPA, the top allergens. However, they are encouraged to have allergen statements on the label. And USDA follows FDA's less than 20 parts per million guideline for any foods that claim to be gluten free. So, what about advisory statements? I'm sure you've seen these statements, such as processed in a facility or on shared equipment that also processes wheat. And these statements are voluntary. They may or may not take the necessary steps to prevent cross contact. These statements do not necessarily correlate with presence of gluten, and foods labeled gluten free must contain less than 20 parts per million of gluten, regardless of ingredients or cross contact. And for foods not labeled gluten free, safety must be determined on an individual basis. So, contact the manufacturer for detailed information about processing procedures and ask questions such as: is gluten used on the same lines of equipment? What are the cleaning protocols between batches? And do you test for gluten? So, let's look at some of the confusing ingredients that you might come across on the label. First one, modified food starch or starch. And this is usually from corn. If from wheat, it will be listed on the label if it's an FDA product. Note that rye and barley are not used as starches in food. So, flavorings, natural artificial flavorings may contain malt, although that is rare, or wheat. If from wheat, it will be listed on the label in FDA products. It may be in cereals, butterscotch sweetened beverages, tea, or soy milk. And seasonings, may contain wheat as a binder or filler, but it would have to be declared on the label. And caramel coloring is usually from corn. If from wheat, it will be declared on the label for FDA products. And dextrin is usually from corn. If from wheat, it will be declared on the label for FDA products. And maltodextrin, also same thing, usually made from corn. If from wheat, it will be declared on the label if FDA. For soy sauce, many contain wheat. And if from wheat, it will be declared on the label for FDA products. And smoke flavoring may contain malt, so be careful with that one. And as I mentioned previously, yeast extract or autolyzed yeast extract may contain malt. And for more confusing ingredients and more explanation about each, check out the links on the landing page of this presentation. So the following ingredients are safe even when derived from wheat or other gluten-containing grains because gluten is removed in the processing. And these include distilled vinegars, distilled alcohols, citric acid, and glucose syrup. So I just want to note with the vinegar, so malt vinegar is not distilled. It still contains malt, so malt vinegar is not safe. So product research is a vital part of staying gluten-free. And it's really important to know how to contact manufacturers because you'll be doing that quite a bit. Um, Best way of doing this, there's usually a contact number, usually a toll-free number on the product label. And you can call them or you can visit their website and review their FAQs. And be very careful to verify your information found on the internet lists, um, especially if it's not the company website, because it might not be the most up-to-date information. So always make sure you go to the actual company's website. Um, and then you can also email the manufacturer through their website. This may take a bit of time. I find that the quickest way really is calling the manufacturer and talk to their customer service directly. And ask to speak to a manager if your question is not answered. And when in doubt, do not risk it. So, what about medications? So, gluten is sometimes used as a binder or filler in medications, although this is rare according to the FDA when they have tested medications. So, you should always check your medications, both OTC and prescriptions, for gluten free status. Note that the rules for labeling of medications are different from that of foods, so fillers can be derived from wheat but not declared. And the FDA has issued a draft guidance for how gluten should be labeled on medications. However, it is not required. And you may see this statement contains no ingredient made from gluten containing grains, wheat, barley, or rye. So, how do I find out if a medication is gluten free? So, inform your physician and pharmacist of your gluten free requirement. And also check the pharmaceutical insert or ingredient listing for both prescription and OTC medications. You can also contact the pharmaceutical company directly for gluten-free status. Usually by calling them is usually the easiest, or going to the website. You can also check out glutenfreedrugs.com. And this is a website that is maintained by a pharmacist, and medications can be looked up for gluten-free status. So if you are not able to get a gluten-free medication, you can also use a compounding pharmacist. And this is where they would make the medication, by using the active ingredients with gluten-free filler ingredients. While having celiac disease or another gluten-related condition does not define a person, living strictly gluten-free has to become a way of life. The next few slides will help you to identify lifestyle changes and how to navigate daily life. Advocating for your health is something you have to get comfortable with being on a gluten free diet. Asserting what you need can be challenging and feel repetitive and frustrating at times. But view this as a positive to educate others about the gluten free diet. These are some situations where you have to advocate for yourself, such as sharing a kitchen, holidays and celebrations, eating out, and travel. And I really like this quote from Jax Peters Lowell. It's better to look silly than to get sick. Remember, there are worse things to be called than fussy. So, there are many issues related to celiac disease, not just staying gluten free. I like to use this celiac iceberg to represent everything that someone with celiac disease might struggle with. Most people know about the top part of this iceberg, but not the larger bottom part. When people get diagnosed, they first feel relieved to have an answer. They have to go on a gluten free diet to remove their symptoms. So the top part of this seems pretty straightforward. But then we often get overwhelmed with the bottom part of the iceberg. These are things you can run into, such as barriers to diagnosis, delayed healing time, complications, hypervigilance with the diet, lifestyle changes, economic burden, high treatment burden, psychosocial impacts, disruption of school and work, and nutrition challenges of the gluten free diet. Here are some common psychological challenges around the gluten free diet, such as anxiety, depression, isolation, fear of getting sick, embarrassment, perceived annoyance factor, and feeling like other people think you're just picky. And studies have actually shown that celiac disease and the gluten free diet affect quality of life and has a high treatment burden. In terms of quality of life, studies have shown that those who are hypervigilant with a gluten free diet have a lower quality of life. So it's really important to have balance here. You have to be careful, but not to be so careful that you isolate yourself or become fearful of foods. And in terms of perceived high treatment burden, studies have shown that the burden of a gluten free diet is comparative to that of congestive heart failure and end stage renal disease. And the higher the perceived burden, the less likely it is that people will adhere to the diet. And since we have focused on a lot of negatives of celiac disease and the gluten free diet, let's focus on some positives. I also want to note that I have celiac disease myself, and I also have a child with celiac disease. So I'm not just making this up, I'm actually living this diet every day too. And we are lucky to be diagnosed. We have an answer. An estimated 80% of people with celiac disease are still undiagnosed or misdiagnosed with other conditions. And we generally eat fewer artificial ingredients and GMOs, and we become experts at reading labels and know what we are putting into our bodies. We can practice cooking and baking. And this last one is my favorite one. We often get to choose the restaurant when we go out. So let's talk about cross contact. I mentioned cross contact throughout the presentation. Even small amounts of gluten can make someone with celiac disease sick. Therefore, a large part of staying gluten free is watching out for cross contact with gluten. Cross contact with gluten means that a food has touched or intermingled with gluten containing foods or grains, or surfaces or utensils that have gluten on them. And this can easily happen in the kitchen. Here are some common examples where cross contact can occur: crumbs on tables and counters, crumbs in toasters, cooking utensils that are shared between foods, pots and pans that are not cleaned properly, cutting boards and knives that are shared between foods and not cleaned, spreads and condiments are shared and contain crumbs, and baking with regular flour at the same time as preparing gluten free foods. When you're sharing a kitchen, make sure to wash counters, microwave turntables, pots and pans, measuring cups, spoons, towels, etc. And keep a separate toaster, strainer, colander, sifter, wooden utensils, cutting boards, cast iron pans, because these are very difficult to clean. Also keep separate, fryolator, air fryer, waffle iron, and sandwich maker. And do not use utensils between foods. And no double dipping in condiments or foods, as this can introduce gluten into the gluten free foods. And here are some helpful tips: store gluten free products separate or above gluten containing products, and label or color code gluten free items. Holidays and celebrations can be a challenge in the beginning. You might need to plan ahead more. Here are some tips to make holidays and celebrations easier. Find out in advance what will be served. Let the host know about your gluten free need. Ask about ingredients and prep methods. Offer to help the host with cooking or providing the food. Potlucks are great. You can bring an appetizer, entree, and dessert, so you are sure there'll be a complete meal for yourself. Um, and be first in line to take food to avoid cross contact. And buffets may seem like a good idea, but there can be cross contact between foods. Make sure there are separate serving spatulas for each dish, and make sure foods containing gluten are not next to gluten free foods. And beware of double dippers. And finally, be the host. Make the whole party gluten free. Invite people to your home and let them try gluten free foods. Gluten free can be delicious, and you don't need special foods to eat gluten free. So let's talk about eating out. You can still go out to restaurants even if you require a gluten free diet. It just takes a little bit more research and education, but you will get the hang of the process quickly. So before going, the first step is to research. Look up restaurants and menus online. You can use NCA's restaurant search feature. The link to our restaurant search feature is available on the landing page of this presentation. Ask friends and family in the gluten free community for recommendations and feedback, and call the restaurant and talk to them about gluten-free menu options and procedures for gluten-free foods. So off hours are best, as they may not have time to talk to you on a busy night or on a weekend. And when you arrive at the restaurant, alert the manager and all staff about your gluten-free requirements. Ask if a gluten-free menu is available, and always bring a gluten-free dining card that explains the diet to help educate staff. So the link to NCA's dining card is available on the landing page of this presentation. So when ordering, ask about all foods and be particularly careful with sauces and thickeners, broths and soups, soy sauce, spice mixes and flour dusting, salad croutons and dressings, breaded or battered foods, fried foods, bread served on top of or the side of food, vegetables cooked in pasta water. I just want to touch a bit on the fried foods. Most fried foods, they seem gluten free, like French fries, but if they're fried in a non-dedicated fryer, fried with all the battered foods, the oil is going to contain, traces of gluten, and that's going to cause cross contact with gluten. So you need to make sure if they're offering fried foods that it's in a dedicated gluten-free fryer. And here are some general preparation guidelines for the kitchen. So keep gluten-free items separate to prevent cross-contact. Ask for separate preparation and cooking station. Use separate equipment, fryer, utensils, and tools. Clean grill before cooking. Place items on aluminum foil when toasting. And do not steam, bathe, or warm vegetables over pasta water. And you can download our gluten-free meal prep guidelines for restaurants. And this can be helpful to bring with you. And this link is available on the landing page of this presentation. So, how about travel? You can definitely enjoy traveling while gluten free. It just requires some additional preparation. So, research restaurants and stores ahead of time. I like to use an app such as Find Me Gluten Free. Carry gluten free snacks and bread. Have gluten free food shipped ahead. Book a room with a refrigerator or a kitchenette so you can have the option of preparing your own foods. And request a gluten free meal when flying. And this is sometimes available on international flights. Look into travel companies that serve gluten free customers, and choose locations where gluten free is part of the local cuisine. So, National Celiac Association, or NCA, has a lot of support and resources that you should check out. It will help you when trying to navigate the gluten free diet, and we have a wonderful community of support. In this section, I will go over the resources that we have available and helpful web links. So, what does National Celiac Association do? So, we represent and serve individuals with celiac disease and other gluten related conditions. We have programs and an extensive support network of chapters, local partners, resource people, 60 support networks and counting, pediatric support through ROC, Raising Our Celiac Kids program, a Supporting Celiac Seniors program, and a food assistance program called Feeding Gluten-Free that provides food assistance around the nation. So we also offer NCA News, which is a monthly e-newsletter, which is free, Gluten-Free Nation magazine, which is a print magazine, online webinars, virtual and in-person support groups, an Ask the Dietitian feature where you can submit questions, and two in-depth educational websites, nationalceliac.org and raisingourceliackids.org. Those of you with children will find more in-depth information relating to children and teens over on our ROC website. We also offer a free online course, Getting Started Gluten-Free in 1, 2, 3. This course is packed with everything parents and caregivers need to know about celiac disease and the gluten-free diet. In addition, we offer downloadable materials for navigating school and 504 plans, a college guide, and much, much more. So check out raisingourceliackids.org. We would love to have you. Please consider becoming a member of NCA. Your membership helps our nonprofit organization educate and advocate for the gluten-free community, as well as provide important resources to those not yet diagnosed with celiac disease. So make sure to check out membership. A link will be on the landing page of this presentation. And here are our contact details. And we answer the phone 5 days a week during business hours. You can call us at 617-262-5422 or call toll free at 1-888-4-CELIAC. Or you can email us with general questions at info@nationalceliac.org. Finally, here's a selection of reliable online resources. They will also be available at the landing page of this presentation. Thank you so much for taking this course. If you have any specific questions or feedback about this presentation, please email me at katarina@nationalceliac.org.